I'm so excited and privileged to have Gerald Mboowa. Gerald is my supervisor. He's also my mentor who has walked the journey. I cannot talk about my career growth and journey without mentioning the name Gerald somewhere in the story, and it's a privilege to have you here, Gerald. Gerald, you are such a good mentor. I want to tell you this on screen. You just don't mentor, but you support. You support people. You support people on their journey, and I don't know what your leadership style is quite inspiring. And for someone like me who is also now mentoring others, there is so much I can learn from you. But also, this is like a ripple effect because I've been mentored well. I am still being mentored well. I'm able to pass on that kind of skill and mentoring to other people. So whatever you're doing is changing the world in different ways. You could think it's probably me and maybe the people you see, but when we go out there, we're actually passing on the skill that you
that's good feedback. Yeah.
I think for me, one of the pledges I make is when I learn something, how best can I transfer that to another person? Because I think there are many ways people define success, but I think there is so much fulfillment in knowing that whatever you're doing is helping other people in the same line, and that's why you have CareerBiome, and that's why you have these interactions.
Thank you very much, Maria, and thanks for hosting me on this channel.
Yeah.
Yes.
Hello viewers, good morning from wherever you are. Welcome to another session of CareerBiome. Today I'm very excited. I have a special person here who is also a trailblazer in research, who is my supervisor, who is my mentor in academia, in research. And it's a pleasure to have you here, Gerald.
Nice being here also and being part of this discussion with you.
Yeah. So this is CareerBiome. As you mentioned, we bring you people who are doing work in research and careers in science. And Gerald has been a huge part of my journey as a researcher. And it's interesting because, I mean, we have moved together from my bachelor's to my master's and now to my PhD. But Gerald, I have a little thing I wrote about you here so that the viewer gets clearly who you are. I'm going to just read it out and then we'll carry on. So one thing, Gerald doesn't like to be called doctor.
Yeah, that's okay.
Okay, we can leave that, but I'm going to say Gerald is a visionary scientist advancing global health through genomics, bioinformatics and public health, and particularly across the low and middle income countries. That is where his work focuses mostly. His work blends cutting-edge genome sequencing with practical, high-impact tools for public health systems like the RMAP, HIV drugs pipeline. These are tools that are actually shaping how we respond to antimicrobial resistance, to HIV drug resistance across Africa and beyond. And I just want to say, beyond the data and research and the global impact that Gerald has, he's someone who sees people, who sees mentees, who sees his students, and he builds capacity. And I am privileged to be one of the people that he has under his watch of studentship as a PhD student.
And you have not disappointed.
I'm so glad that he says that even on screen. So let's get into this, Gerald. Talk about some of the tools when it comes to implementation science, because you have viewers that sometimes read about these things and do not necessarily understand or see the faces behind some of this work that he's doing. So tell us about RMAP, HIV drives, and the impact it has.
Thank you very much, Maria, and thanks for hosting me on this channel.
Yeah.
So looking back, of course, during the trainings that we have, we are taught on how so much stuff that we learn in class.
Yeah.
But again, when you go back to your own settings, it is very much important for you to try to translate whatever you learned in class, which is much of the times very theoretical in a sense.
Yes.
But it gives satisfaction if you translate whatever you have learned in a way that can impact real life in the actual settings where you stay.
Yeah.
The same way I see you are trying to learn whatever you're learning, but you find a way of like making it very impactful in a way that you feel it can. So having gone to school, learn whatever we learned, like you have seen, infectious diseases still remain a big component of our day-to-day lives, especially in the low-income settings, like in Africa largely. So having learned bioinformatics, we saw like personally try to look around and see what was there to do analysis of data in case you have data in the lab from infectious disease outbreaks or from even routine clinical samples.
Yes.
You want to see what bacteria are there, what infectious agents are there, but also their drug profiles. And whatever licenses I would come across, a license of a tool in bioinformatics can cost about $10,000 a year.
Yeah.
So you buy, and then every year you have to renew this license.
Incredibly expensive.
Expenses, other expenses. But the beauty of that license, it is like a software you put on your computer. You just touch a button and it gives you a report.
Yes.
So meaning someone has gone so much into making it that much easy or user-friendly in a way that even an inexperienced person, someone who has never, someone who doesn't even know about this bioinformatics, genomics, is able to plug this and get a report.
Yes.
Because in real life, the clinicians who are acting upon these reports, many of them don't have the experience of bioinformatics. So that's why those licenses are very expensive. So we just sat with our team at Makerere University, and then we tried to get what we call open source tools. Open source means someone develops a software and puts it out there in public space for use without paying, even without contacting them.
You know that it's accessible to the general public.
Yeah, anyone can, even though that you don't have to go back and write to them, please can I use this tool?
Okay,
You just use, So we had a team with Stephen, you know Stephen, of course, Ivan, Salada, who is also my student. So we assembled these tools and created these pipelines. A pipeline, I know sometimes Maria tries to break down these complex terms.
No, please go ahead, because every time I speak, it gets a more bigger audience.
Exactly. So a pipeline is more of like, the word pipeline is, as you say, pipe. Meaning, you have one thing you put in this side, and so many things happen along the way, and then you get the product on the other side. So that's why you call it a pipeline. Meaning, you get your samples, put them in one side, and then the things happen along the way. It is moved to a level where you have like something coming out of this pipe, and then that's a simple report which can be understood by anyone. For example, the example I can get is if someone has a cough and we say this cough is TB, and then we pick sputum sample or saliva from this patient, put in this pipeline. So many things will happen along the way, but we get a simple report out of this pipeline that says there's TB, and this TB can be treated with these drugs, or is resistant.
Drug resistant.
It will also tell you that it is resistant to these drugs. So that is the kind of this, in simple terms, that's what I'm talking about, the pipeline. So we developed two. One is to do HIV drug resistance. It's called HIV drives. I think Maria will put those links.
I'll provide the links to the papers.
So HIV drive meaning you get a sample from an HIV infected person, and then you take it through this pipeline, and it is able to tell you this person will respond to these antiretroviral therapy drugs. These available HIV drugs. So that's what is all about, the two pipelines, and the other one is all about telling you in case you're suffering from this bacteria, you have this bacteria, this sample, the skin sample, or a sample from urine, and it is able to give you a profile of the drugs that are able to treat that bacteria. So that is all about the two pipelines.
Amazing work right there. And I think for me, one of the interesting things is that these pipelines were worked on or developed using data from our setting.
Exactly.
So there is representation, there is representation in some of how these tools are developed. It's not that we are reliant on external data, but that is what is all about building capacity in the African setting, and he is one of the brains behind these tools that you're hearing.
And maybe importantly, one thing I forgot is why the difference between these tools and then the commercial licenses is because the one who makes a commercial license will patent it, so that you cannot use it without paying. Well, the ones we have developed in our settings, you can use it without even getting back to us. You get it from it's open source. You get it used. Even if you don't tell us you're using it, you can use it without having to get back. The only challenge is it requires you to learn a bit of how you bring the different parts of it together to make it work. But it's open access.
And maybe the end result is just how to interpret what result it's giving you. But I think that's a small part of the entire thing this pipeline does. It mostly moves the steps for you and
takes it to the other level. But of course, the output is almost close to what you get from a commercial license. But the people who have patented the other licenses, they sell them expensively because they need to make money out of them. While like, in our settings, much as there isn't certain technologies to do analysis, when it comes to the pipelines, developed world have gone a level higher.
When it comes to, for example, the tools you've mentioned about RMAP and HIV drives, this is at the core of implementation science. The viewer might not, because you have a wide audience, how are these tools helping and what is at the center of their impact?
Okay, so I should start from where you talk about global health and then public health.
Yeah.
So you realize bioinformatics or applying bioinformatics in real world space or in global health has also some challenges.
Yeah.
For example, there are tools that have been developed to do exactly what RMAP does, to do exactly what HIV drives does, but a license can be bought at annual license of like $10,000
which is incredibly expensive.
That's like someone is annual salary somewhere in the low income setting. So you realize that you cannot buy these commercial tools. They are well developed, but laboratories elsewhere, in public health laboratories in high income settings, they can buy these annual licenses and then they just get their data from the machine, take it through this licensed version of this platform, and they get a report that they can use to act upon whatever results they have.
Okay. So I'm gonna switch the discussion just slightly a bit. Gerald has a PhD, of course, and
You also have a PhD.
mine is in development, but it's going to come soon. Gerald, you know there's so many PhD students actually audience of this group, and I'm expectant and wondering what you have to tell them about, first of all, navigating, because the PhD itself and the coursework is just a bit of a puzzle, but like navigating through. And I need to mention that among other people I read about, Gerald finished his PhD in record time, so the pressure is up there, especially because he's my mentor, and so somehow I feel like, yes, you have, first of all, you keep shifting the goalposts, but also when it comes to PhD studies, how are you able to, first of all, do your PhD in such record time, but also how you navigated some of those challenges, and
That's a good
especially
question. I never to ask about that. So of course, when you set yourself up to start a PhD journey, there are some things that you have to accept in life and say, okay, this is going to be a commitment. A commitment. If you decide to say, okay, this is a commitment, it's not going to be an easy walk. Commitment means comes with challenges, and you're able to say, okay, whatever challenges I'll get along the way, I'm going to persevere. So that's one thing I can't say that from the word go, just know this is a commitment. I've set myself up to do this PhD, and I have to make sure I take it to the end. Challenges will always be there along the way, but each time you remember that this is a commitment, then you wake up in the middle of the night, you pick up your computer, you get to work. The day you stop thinking this is a commitment, then you give up and walk away. But also the other thing you have to know is, it is interesting along the way that you learn so many things. I think by now there's so many things you have learned during your PhD training. That otherwise, I probably think you wouldn't have learned in case you
it has been very eye-opening
in
so many, and not even just academically, but also like managing stakeholders, life, and all of that. So it's more than, it's such a comprehensive kind of environment and training that taps into all these different facets. And there's no one manual. You can't say, okay, I'm going to read this book and then after reading it, I'll be able to do my PhD smoothly at the end. No. It's all about how you deal with fellow students, university administrators, supervisors, publishers, like you know, like in a PhD sometimes
you have to
policies,
sometimes policies, and sometimes you have to get your data from the ministries. And then you have to go, you meet people you have not met before, prepare yourself now to convince them to do something they have not done before. For example, it may be like you need them to give you data sets from patients from the ministry. Say maybe Ministry of Health. This is not data you get by just presenting yourself in a most lousy way. No. Sometimes you have to assure them that, you know what, I know what I'm doing, and there will be some benefits at the end of the day. So it requires you to like learn so many things and apply them at the same time. So you learn and apply them at the same time. You have to approach someone, is in the ministry, prepare yourself. Now you're going to present yourself. Then go and talk to this person. They refuse today, you go back. They refuse tomorrow, then that time they may say, okay, yes. And then along the way, there are some things you may need to know that maybe in your PhD training, you may need to use a specific, maybe software that you don't have money to buy, but there's someone you know who has developed this software. You need to write them an email and tell them, please, can you offer some free time and train me? So there's so much. There
is so much in there. Okay, and Gerald has been a focal point also in the data revolution in Africa when it comes to genomics, bioinformatics, and he has done tremendous work out there. Gerald, what is the kind of vision you have for the African data community or the African genomics community? What can the people learn from this? And let's say to kind of understand where we are now, because many times we do work in labs in confines, but the public doesn't necessarily understand. Yet we are developing the work we are doing for the public.
Yeah.
So for the person watching this and they're probably wondering what they say the state of the data genomics in Africa or data science is, and let's say in your opinion, like the vision there is and where we are headed based on the capacity that is being built.
I think the capacity is being built, but at the same time, I think we need the infrastructure to handle whatever is being built. Yeah. So many labs right now generate lots of data, big volumes of data, but when you ask them, do you have like a server here keeping this data? Many of them don't. Yeah. So you realize that there are very few options. Either generate it, act upon it. Acting means manage patients or manage policy in case maybe you are detecting resistance to a certain drug. Inform policies that they roll out or they roll in this drug, roll out this. There you are informing policy, but again, this data you have used to inform that policy. Is there an archive where you can put it? But at the same time, again, you don't want to just collect and keep somewhere without giving it a chance to be mined. Mined meaning people are able to analyze it, to get more insights into what can still help people or global health in a sense. So it's tricky because some countries again are so much interested in holding on to this data, at all costs.
And there's so many discussions about who owns the data, who uses this data.
Of course, the nations have the mandate to define how this data can be used. But again, being too stringent on how this data can be shared and used is not helpful. In all ways. So there's so much that can be learned in big volumes of data. And again, it is more meaningful if you're bringing in data from more than one country about a particular aspect of life. For example, if you want to see, okay, how has the death, the mortalities maybe to a certain disease changed over time? At a country level, you may be able to see much. But if you say at a continental level, there's so much you will see in that you are able to say in Uganda or in country X, the mortality has reduced compared to country Y, which are in the same kind of geographical setting. Then you're able to learn from the other countries and say, okay, how different are those statistics from ours and what may be accounting for. Because at a country level, you may see these changes, but you may not be able to account for what maybe causes those changes. But if you bring data from more than one country within the same geographical settings, then you're able to understand what may be associated with whatever statistics you are seeing. So there's need to protect the data, but again, overprotecting it without giving people a chance to mine it, to derive insights from it, may not be that protective. I mean, meaningful in the long run, especially because we all are aiming towards like improving patient outcomes and of course improving global health. And Gerald, you're one of the people who I got to learn bioinformatics about. Like the first time I had bioinformatics, I think you're one of the very first few people. But at the time, it was completely a whole new area in Uganda. And you're one of those first people who did that. So I just want to know, is into like how you got to learn about bioinformatics and what that is. Because when we talk about this thing, it's like right now many people know about it. But being you one of the first people that went in and you actually went in wholeheartedly, how was that for you and how did you get to know about this whole concept? It's a nice question. I like that. So
thank you.
Going back in 2014, I had graduated from my bachelor's in 2009. So I worked in the lab, getting samples, culture them, and then at one point we could ship samples to a broad institute.
The broad institute.
In the US. That was 2014. So I was responsible in doing the collection analysis, and then you reach somewhere after growing this TB bacteria. Put them in vials and then put it on a plane, take it to broad institute.
Ship it out,
So one time I asked Professor Moses, why are we shipping them? He said, we don't have the technology in Uganda to sequence
the samples.
Then I said, can we learn? He said, okay. But he said the machine is again too expensive. So I backed off a bit for some time. But of course, each time they would do the sequencing, they would have a small Skype meeting. These days people talk about Zoom. Those days it was Skype. And then they would update us what they did. We sequenced, we did this, and then we have the report. And they would just see sequences. SCTGG. I think my understanding stopped here. I can't understand it. But for me, I took it as a challenge and said, okay, one day this is something I would want to learn. So I enrolled that same year,
Yeah.
around, I remember the dates very well.
Yeah.
It was May 2014.
2014, wow. Yeah.
The last week of May 2014. So
Yeah.
Professor Joba came back to the lab and said, I've been invited to the H3 Africa meeting in Stellenbosch in South Africa.
Yeah.
And they need our career researchers.
Yeah.
Can I go with you? So he told me, can I go with you? I said, of course.
Yeah.
Yeah, he told me, process your visa, then we go. So
Yeah.
I went with him. We are the inaugural high career researchers for H3 Africa.
Amazing.
Yeah, so
Yeah.
we formed a small team, and then after that discussion, they said that we want individuals to do PhD.
Yeah.
That time I had just finished my master's.
Your master's, yeah.
So I said, I'm here. Can I go?
Yeah.
So I went to Texas, Beta, College of
Texas,
Medicine.
yeah. Yes.
So we did bioinformatics, genomics. It
Yeah.
was a steep learning process.
Yeah.
Yeah.
Because
But
you had not had any prior exposure to coding.
No.
Okay.
Not at all. So the only time I touched a computer at the university was when I was writing my research.
Oh, wow.
Yeah, so I didn't
The
know.
journey is always
I could only use it open and
I like to hear such stories because it makes this whole journey seem human,
Yeah,
and
so-
anyone else there relates to this kind of bit where they are.
But
Yeah.
of course, what you have to look at is there was a challenge,
Yeah.
and then you see it and say,
And then
okay,
you spotted
yeah,
it,
it's
yeah.
okay. How can I take advantage of this? Because at first I thought I was enjoying what I was doing on the bench, but
Yeah.
I realized from start to the end I was stopping somewhere.
Yes.
Something was supposed to be done,
To
but
be
I couldn't
continued
do,
with, yes.
do that.
Yeah.
Settings, we didn't have the machine,
Yeah.
we didn't have the expertise. Yeah, so the samples were being taken to the Broad Institute there
Yeah.
for sequencing.
Yeah.
Yeah.
Okay, now I'm trying to put the pieces together because when you say Broad Institute, right now you are at the.
Yeah, that's right.
Is it the Serum Institute?
Yeah.
It's such a full circle moment because
It's a small world.
it's such a small world. So Gerald has, of course, had affiliations with. He still has affiliations with many places, but the places I've known so far is Macquarie University. He's still a lecturer there, and of course, an affiliate and associate there. And then Africa CDC, and now the Broad Institute of MIT and Harvard.
Yeah.
And for me to hear now that at that point, when he was doing his bachelor's and master's, he was looking at Harvard, at the Broad Institute.
Yeah.
By just sending examples there, but now he gets to be there. I think it's amazing. It's,
It's challenging me because I was
Yeah.
saying, like, why are they taking it to that place? So they
Yeah.
are telling me globally it's a place where genomics and bioinformatics is done. And so
Yeah.
that's what I knew about it then. But of course, it's a small world. As time passes by,
Yeah,
you never know. For now, some things may be out of your reach. But you can never say never.
Yeah.
With time,
the pieces start to get to go in place. Yeah. The other thing Gerald does is he has, of course, I've talked about mentorship, and I think this is at the heart of CareerBiome, talking about the journeys in science, about what work is being done. And Gerald, you are such a good mentor. I want to tell you this on screen. You just don't mentor, but you support. You support people. You support people on their journey, and I don't know what your leadership style is quite inspiring. And for someone like me who is also now mentoring others, there is so much I can learn from you. But also, this is like a ripple effect because I've been mentored well. I am still being mentored well. I'm able to pass on that kind of skill and mentoring to other people. So whatever you're doing is changing the world in different ways. You could think it's probably me and maybe the people you see, but when we go out there, we're actually passing on the skill that you give us.
That's good feedback. Yeah.
I think for me, one of the pledges I make is when I learn something, how best can I transfer that to another person? Because I think there are many ways people define success, but I think there is so much fulfillment in knowing that whatever you're doing is helping other people in the same manner, and that's why you have CareerBiome, and that's why you have these interactions. But Gerald, the other thing I need to mention about Gerald is he is so prompt in responses. I've never seen someone as prompt as you, and
Really?
yes,
I try.
You will send and we are in different time zones at the moment sometimes, but I'm so happy that today we meet in Ghana. By the way, we are at the Data Science in Health consortium meeting in Ghana. It's a conference that brings together people doing data science and research and people discussing some of the work that they're doing. We have panel sessions. And anyway, there is so much work that is happening. But back to the point of mentorship, just tell us what inspires the kind of your mentorship style in terms of how prompt you are in responding to emails. You could send an email to Gerald, because let me tell you, before you get into that, I know that for my journey, I've had, of course, a number of applications, and he's one of my first recommenders almost everywhere. But there is something that is powerful about you sending someone a message or email and tell them I'm applying for this, and they send you a recommendation letter. In the same minute, you ask for that. I think it's about Jared. Like, what inspires the kind of mentorship style that you have, and do you want to speak more about that? We could learn a lot from you.
Okay.
Yeah.
Yeah. So I think it goes back to the time I was also at the university.
Yeah.
And I approached the senior person and I said, I'm applying for a master's,
Yeah.
a PhD then,
Yeah.
and I need a recommendation. He told me I can't give it to you.
Oh wow.
Yeah, so it was very open, and I said, no, I can't give it to you. I said,
Yeah,
why? He said,
why?
I don't know you much. But that time I had been working with them for some time, almost 4 years.
So you were not a stranger.
I wasn't a stranger.
Yeah, you were part
but
of the
I went
team.
back and
Yeah.
asked myself, like,
Why?
can a recommendation be that much
Yeah.
a problem?
Yeah.
Yeah, I was asking myself, why?
Why?
I promised myself that, you know what? Because for me, the deadline was almost like in a week's time.
Yeah. So you had some
That I
time
really
to work
needed
with-
it.
Yeah.
Yeah. Then I went to someone, I forgot that person passed away. It's called Doctoral. Yeah, he was in pathology in Malago. He passed away a few years ago. So,
Rest in peace.
yeah. So I went to him, I told him I want to start a PhD and I need a recommendation. He just said, where's the form? He
then
signed
he
for me.
signed quickly,
He didn't
yeah.
ask anything.
Yeah.
But this is someone who was distant. You know, when you need a recommendation, there are
Yeah.
people you start ranking
Yes.
in your own space and say,
Yeah.
I need a recommendation, I'll go to Maria, I'll go to
Yeah.
so.
Yeah.
So Dr. Amara wasn't in my list.
your
even.
list,
yeah,
yeah.
but this is someone I would meet.
Yeah.
I was working with on his project.
Yeah.
He was also that time doing his PhD, so I would help him on his project, analyze for him samples.
Yeah.
Yeah, so he just signed for me and without asking a question.
Yeah.
So I realized I made a decision and I said, okay, the person I want to be different from the person who has
Who
denied me.
refused to, yeah, who
Because and
denied.
again, sometimes people are doing so many things.
Yeah.
You sit on your
Sometimes it's
computer and then you send
understandable,
me a recommendation. I know.
Yeah.
Let me give it to you when you're still on your computer.
Yes.
For me, that's the kind of like understanding I take. Like,
Yeah.
I don't want you to send and go to bed thinking
Yeah.
by tomorrow I'll give it to you.
Yeah.
No. And even then, even me, I'm like, you may think you have sent me one,
Yeah.
but I have
But
like
the
4. Yeah.
others, yeah.
If I start pushing this one
Yeah.
and say I will reply to your recommendation maybe tomorrow.
Yeah.
By tomorrow there will be 6.
Yeah,
Then
waiting.
I'm
So
unable,
it's a
yeah.
pile up.
So it's better you say, okay,
Yeah.
you want one,
Yeah.
let me give it 5 minutes, I'll give it to you.
Yeah.
Than keep piling it.
Yeah.
Yeah.
Okay. Amazing, Gerald. I also had some more questions for you. Let me see if I'm remembering all of them. Yeah, but it's amazing to have this discussion.
And nice meeting you here as well.
Yeah, over CareerBiome. Or maybe I need to tell you guys, when I had the idea of like coming up with CareerBiome, you guys probably see like the other end of it, but there is so much discussion that happens also mentally and also with the team. I told Gerald about I want to start this platform, and he was so supportive. So part of your encouragement is why we are here. And if you're seeing this, please in the comments thank Dr. Gerald for me.
Yeah, I'm your subscriber, so I always
And
watch
he's, oh yes,
Yeah,
I was so excited. Like when I sent him the link, and I was like, oh, so now the channel is finally live. I'm going to post. He was the first people to subscribe. And the other
Yeah.
thing is when I have like, because recently you've mentored me so well that I'm now being invited to speak in different places. And when
I'm proud of you.
Thank you. Yes, and so when I'm out there, I'm like, oh, but then yeah, like I tell him, okay, there is this talk I'm having. He's always on call, like he's listening in. I think that in itself is support, and it goes a mile because yeah, this journey can be very many things, but you have such tremendous support then. And I keep telling him that on this journey, I've gotten such good support that now the ball is in my hands. Like I cannot say this or that because the support is there, and now it's me to move these pieces
And I
together.
should come to the graduation.
You are going to come to the graduation.
Yeah.
It's happening soon.
I'm making it on camera here, so that you don't forget.
He's putting me in the hot seat,
Yeah.
guys.
should
No,
come
George,
for
you're
the
coming for the graduation. Definitely.
Of course, personally,
Okay.
what I want to talk about here is
Yeah.
to always to have a dream.
Yes.
Yeah. You wake up and then you finish your bachelor's. In many cases,
Yeah.
a big percentage of like people accept the status quo. Say, okay, I finished my bachelor's maybe in computer science or business studies or in agriculture or health sciences.
Yeah.
This is going to be my life and that's it.
Yeah.
Yeah, it is not. This is something that, and of course, taking this aside from how humans have come to be where they are.
Yeah.
They have never accepted things the way they are.
Yeah.
Yeah, they always challenge themselves. If you go back in evolution, they say all humans came from Africa, somewhere around Ethiopia.
Yes.
And then one time they wake up and they say, no, we are moving north.
Yeah.
So they move, they reach where there's a barrier, they have to cross into Europe.
Yeah.
And there was a small ridge, and then they have a few of them crossed on the other side.
Yeah.
They get to that side, they say, no, we have to keep going. They go as far as reaching all continents.
Yes.
That wasn't a one-day journey. No?
Yeah.
Yeah. So some people accepted, stayed where they are.
Yeah.
But there's a group that would wake up and say, no, because Africa is a big continent.
It is.
It doesn't mean 100,000 years ago it was full. That maybe it had 10 billion people that people now started migrating. No, they are not even like 100 million. They are very few.
Yeah.
But the fact that people are always not comfortable with what you are, always push the boundaries.
Yeah.
And it's okay.
Seeking better.
Yeah, they kept moving. They moved Europe, Asia, Australia, Americas, South America. They have reached everywhere.
Yeah.
And now, about 60 years ago, they went to the moon. So and now they are talking about going to Mars.
To Mars.
Yeah,
That
means they have refused to accept things the way they are.
They refuse to settle, in other words. Yeah,
like you finish your bachelor's and then you sit and say,
sit back.
I want to be doing this.
This is direct information for someone watching this and they're looking for the motivation. I think I'm like
exactly that human brain has so much power.
Yeah.
And they have to tap into this power.
Yes.
And the day you stop tapping into that power, you almost dead. That's what I was avoiding to say.
Yeah.
But they almost dead because you have seen what humans have gone through to be where they are.
Yeah.
Up to now, with all the technology they have, they are pushing the boundaries.
Yes.
They wake up and say, you create an hypothesis, you create a problem, and you create an hypothesis and then you have to solve it. It's okay.
Yeah.
What if an asteroid comes and hits this planet and we all die? That will be bad.
Yeah.
The entire Earth will be no more.
Yeah.
Humanity will be wiped out.
Yeah.
So they start saying, okay, let's build these rockets and then go to the moon.
Yeah.
They reach the moon, they realize it's not habitable. They say, okay, let's go to Mars.
Yeah.
And then they will keep pushing the boundaries. But it's because in their brain, we are not settling for where we are. We are not settling for what we are.
Yes.
Start where you are, get to that level, but don't say, okay, I can now pause.
Aim for more, keep going for more.
The brain has so much it can offer.
Yeah.
Keep changing your brain, keep pushing the boundaries. Life is full when you try to challenge whatever you have at that point.
And this conversation really makes a lot of sense because I remember before I even started my PhD, I think I've had like a run of academia as well, from bachelor's to master's to PhD now, and of course it's been part of the journey. But like I remember, I think there was a time I had like a bit of confusion of what is the next step, and this is like the authenticity part about this, is that at some point you're going to feel that way and foggy. And then we had a discussion with Gerald, and he told me, no, keep going because things work out. Of course, with tools, with connections, and everything he brings before me. And this makes a lot of sense because I think the more you go, now I'm getting like a clear picture of this journey, and that's why we are able to have conversations as this. Like the at some point it will not be as clear, but somehow along the journey you take the next step, then the doors keep opening. And it's amazing.
And before you realize, you sit down and say, okay, I think this was the right decision.
Yes.
But sometimes when you're taking it, it may not look so clear to you.
Yeah.
Even you may get confused and say, really, am I taking the right course?
Yeah.
But after crossing on the other side, you look back and say, I think that was.
That was a good decision to take. Yeah. Absolutely agree. Gerald, what do you think we need more as Africans to really unlock the scientific innovation, like when it comes to the kind of work and research we are doing? And what role do you see some of us, the young professionals, play in this game of African research?
It's a good one.
Yeah.
Because we're in this continent and we don't have so much support from the national governments. But whatever they have managed to put in place, each of us can use it to be impactful, because at the end of the day we want to help communities or society get whatever they can get. So I know you are one of the most troubled students I know of, and there are things you will see somewhere and in your head okay, this may take maybe 50 years to work in our setting.
In our setting, yes.
But when you sit hard and look back, you can find a way of not exactly replicating what you have seen there, but find a way you can give back in a way that you can try to change what is there. If, for example, you realize that, in my village, there are kids who can be taken to school if I give them maybe $100 US. For you, it may mean
it's
nothing.
Pocket change, maybe.
But to someone else, it can change their life.
Okay, Gerald, it's been a very lovely talk. Any last words to the viewer and any advice to the current generation? It could be unconventional advice, it could be anything. I'm giving you space to.
Okay.
Yeah.
Yeah, I like that. So,
Yeah.
like going back to where I started from, like,
Yeah.
even at whichever level you are at, don't accept things the way they are.
Yeah.
Don't just engage yourself into a positive state and say, okay, I did my bachelor's, this is where I want to be, that's the end.
That's the end.
Yeah, it may not really be a bachelor's, or it may be even a job. You are doing your job, you got it maybe 5 years ago.
Yeah.
Ask yourself, is this the job I have to do for the next 20 years?
Yeah.
Yeah. Like, one thing she knows about me is like,
Yeah.
maybe after a few years,
Yeah.
I've gone here. So like,
I told you guys there is, okay.
yeah, so
Yeah.
so what I'm saying is,
Yeah.
don't become so comfortable where you are, because
Yeah.
like I've told you the story about how humans have been moving.
Yeah.
Like they have never accepted to be in one place and say, no.
Yeah.
They sit, conquer where they are.
Yeah.
After learning whatever where you are, just imagine you are waking up today, you're a research assistant somewhere.
Yeah.
I can assure you, within 2-3 years,
Yeah.
whatever can be done in that environment, you can do it.
You can do it.
So what more are you going to do? Challenge yourself.
To do.
Am I getting a new job?
Yeah.
Am I applying for a new position?
Yeah.
Am I going back to school?
Yeah.
That way you will keep yourself, eventually you enjoy your life, because if you graduate at 24
Yeah.
and start doing a job of maybe a research assistant, ask yourself, if I'm not retired at maybe 60, am I going to do the same job until I'm
For
60?
all those years.
Yeah,
Yeah.
so
And will I be fulfilled? Will I be happy?
It will
Will
bore
I-
you eventually.
Yeah.
Yeah, and even in a position you are,
Yeah.
2, 3, 4 years, you have learned whatever you need to learn in
Yeah.
that position. Yeah, start seeing what can be the next challenge to take on.
Yeah. Gerald, before we go, what was the hardest part of your PhD? If you want to talk about it, and how did you overcome it?
Yeah, it was so lonely.
It was so lonely. Oh, I'm happy someone is actually validating how we all feel.
No, it was so lonely.
Yeah.
You wake up and sometimes you will spend the day without talking to anyone. Yeah, and even those you are talking to, you are forcing yourself to talk to them.
Like everyone is.
Yeah, people are like, and to some extent, people will isolate you.
Yeah, people.
They will
this journey is
identify
so
you as
lonely.
now like
Yeah.
a mental case and live in your space. So
Because there is even this joke of PhD is permanent head damage, but okay,
Yeah.
not in that sense. But
people
it's
with
very
time they will
lonely.
sense you are no longer the version they are used to.
Yes, yeah.
And then they start discussing themselves, and then time reaches when you feel you want them back,
Yeah.
but you want them on your terms. Like you
Yeah.
want to say, can I talk to so-and-so?
Yeah.
But during your time, not their time. So
Yeah.
that's when it gets more lonely.
Yeah.
But at the end of the day, when you finish, again, the life after finishing is far much
It's nice,
enjoyable. Yeah, because now you can control it, determine yourself,
Yeah.
determine how far to go.
Yeah.
There's so much freedom after that. But
Yeah.
during the process, it's so lonely.
It is very lonely. Yeah. Okay, thank you viewers for watching until this point. What has been the highlight of this conversation? Let us know in the comment section.
Yeah.
And until next time, see you in our next video.
Thank you very much.
Yeah, thank you, Gerald.
Thank you.